we can start with what were the early obstacles to getting the field to recognize the importance of studying cardiovascular disease in women?
Well, the background to this is that I was seeing patients in my clinic. I was seeing women who had heart disease, who had chest pain, who'd had a heart attack. I was seeing women hospitalized, first in the hospital and then subsequently in the coronary care unit. But when I went to the literature to say, how do I treat these women? There were no data. I consulted my colleagues at the Emory University School of Medicine, who uniformly said, well, there's no difference. And that was the assumption. And no one was ready to query whether that was correct. We were beginning to get tests and drugs to treat heart disease. This was almost the renaissance of cardiac care for coronary disease. But all of the studies were studies in men. We were beginning to address preventive interventions, things like the Coronary Drug Project. Again, all men. So trying to find some data, and there was nothing in the literature or in the standard textbooks. I went to the American Heart Association, who told me that it was not a problem, the American College of Cardiology, who said we have the data for men and did not see women as a problem, and then went to the National Institutes of Health. Early on, it was the National Heart Institute. Later on, it became the Heart and Lung Institute. Blood hadn't been added yet, and again, went to them, who said that was really not a priority area. Well, it was a priority for me. And I continued to write to the various people in charge of the groups. And I think finally someone listened. And in the early 1980s, developed a workshop that it was my privilege to lead with two colleagues. And it was an exciting workshop. And, typically the time between a workshop and a conference is 2, possibly 3 years. This was 6 years before the conference evolved. And again, it was my privilege to chair that conference with Doctors Leon Spiroff and Barbara Packard. And the conference essentially followed the format of the workshop, defining what was known about women and particularly coronary heart disease, but some about other heart disease, and most importantly, to outline the knowledge gaps. It culminated in a manuscript that was published in the New England Journal of Medicine in the late 1980s. And at that time, the editor of the New England Journal said to me, I believe this is the first time that a manuscript that links coronary disease and women in the title has been published in a major journal. And it did increase interest. Again, the New England Journal has powerful influence on the clinical and the research community. And many research scientists in the basic sciences and the clinical sciences looked at the knowledge gaps and began to work.